Hi, hello, a warm welcome to everyone. I am Haripriya, Assistant Professor, Department of Costume Design and Fashion. So, this is a video about medical textiles. So, how the medical textiles has been used and what are all the main concept of medical textiles has been going to be discussed on this lecture video. So, first, what is medical textiles? Engineering of healthcare and solutions. So, exploring the critical roles of specialized textile materials in modern healthcare delivery from surgical environment to patient care applications. So, the main medical concept is about what is medical textiles is mainly concentrated on those things which is mainly used how to care the patients and what are all the materials needed to care the patients and what concept the medical textiles has been entertained and how it was used, what are all the main properties of medical textiles and why we concentrate on those things has been clearly discussed on those concepts. So, the next one is 4 core categories of medical textiles. So, the main concept is the medical textiles has been differentiated or classified into 4 types. So, those 4 types has been playing a vital role in medical concept. So, in medical textiles there are 4 classifications. First one is non-implantable material, second one is extracorporeal devices, third one is implantable medical materials and fourth one is healthcare and hygiene products. So, the non-implantable material is the which is for external applications, that is wound dressing, bandages, compression garments and tropical therapeutical devices that interface with the skin surface. So, mainly we concentrate on bandages and the garments or materials which is used to care on the overall the surface, it is called as non-implantable materials. Extracorporeal devices, that is life supporting systems operating outside the body such as the artificial kidneys, those mainly concentrating on which is extracorporeal, which is supporting the human organs to maintain a good life, that is artificial kidney, artificial lungs, and mainly it is concentrated on dialysis and the membrane organizers for the cardiac procedures. So, artificial heart, artificial kidney, and those are supporting materials which is mainly concentrated on extracorporeal devices. Then implantable materials, internal surgical textures including sutures, vascular grafts, hernia meshes and garment replacement designed for biocompatibility. So, the mainly used, that is stents which is used in angiogram and nets used in hernia and artificial intestines, sutures, those are mainly called as implantable, which is it is we are planting inside our body, it is called as implantable materials. And the fourth one is healthcare and hygiene products, clinical environment textiles from surgical gowns and drapes to the hospital bedding and infection control barriers. So, the garments which is used in while treating the patients or the patients wearing garments and the materials used in bedding and draperies, curtains, that are used for in the hospitals, mainly concentrated on healthcare and hygiene products. Those are all main 4 core categories of medical textiles. Hygiene textiles, the dominant segment. The hygiene textiles mainly constitutes the largest segment of the medical textile applications with non-woven materials during the innovations and across the personal care and inconsistent management products. The market significance, non-woven, the main concept of medical textiles, it is non-woven. So, the non-woven accounts for 23% of all non-woven material consumption globally, reflecting the massive scale of hygiene textile products. The core product categories are napkins for the infected and draperies, diapers and sanitary napkins, adult instance products of elderly and medical care, hospital under and protective bedding. So, the main concept is about disposable one. So, this is the main concept of non-woven. The moisture wicking technology, that is the absorbing capacity, it is called as moisture wicking. So, the modern hygiene textiles incorporate the advanced moisture management system and that rapidly transports the fluid away from the skin contact surface and maintaining the dryness and preventing the irritation. So, the main concept is absorbing concept. So, the next one is advanced wound care. So, the advanced wound care is absorbent pad layers, wound contact, alginate and chitin fibers. So, those are all some of the main concept of advanced wound care. So, first one is absorbent pads, that is absorbing the direct blood fluids or something which is directly from the wounds. Second one is wound contact. If some wound is treated with a textile material, it should be somewhat having some properties. Alginate and chitin fibers, which is mainly concentrate on if the bandages stick to a wound, it should not directly attack, it won't attach to that wound. If it is taken means it won't causes any pain or any irritations on that particular wounds. So, we have to use properly and it should avoid those things. So, next one is infection control through surgical textiles, critical barrier applications, operating gowns and drapes, surgical masks and caps, sterilizing wraps. So, those are our main concept of infection control through surgical textiles. Surgical mask engineering, outer layer fluid transistor non-oven facing repels droplets and splashes from surgical procedures. Filtration core, glass microfiber middle layer provides the exceptional bacterial filtration efficiency and exceeding 95%, and inner layer soft breathable non-woven material for water comfort during the extended surgical process. So, the mask has been properly engineered to avoid those main concepts. Antibacterial technologies. So, the material has been treated with some properties, that is antimicrobial, antibacterial and then antiviral. Many concepts are there. So, we have to treat those properly because we are directly using on wounds and directly used into the body. So, we have to give some proper finishes so that it may leads to good conditions. The main concept is surface finish treatment and the bioactive fiber integration and antimicrobial wound dressing. So, those are main concept of antibacterial textile technologies. Material performance comparisons. So, we have to concentrate on those things. If there are some properties, how we have to define the fibers or a fabric and how it should be having some characters. So, bacterial barrier, it is for woven cotton it is moderate, for a non-woven synthetics it is excellent. Lint generation high, in the woven cotton has high. So, the contamination is risk minimum, it is to 0 in comparative to non-woven synthetics. Next one is moisture management, absorbs and retains, non-woven it wicks and transports. So, it is absorb and it transports it. Next one is sterilizing cycles, limited reuse capacities, single use or extended durability. Cost efficiency, reprocessing expenses, disposable costs affects by performance. So, those are main comparison between the woven cotton and non-woven synthetics. The key takeaways of the medical devices development: material science integration, clinical performance standards and suitable considerations. The success requires an understanding fibers properties, non-woven technologies and bioactive finishing systems, clinical performance standards, balance bacteria barrier efficiency, moisture management and patient comfort in products efficiency, sustainability consideration, evaluate the life cycle impact of the single use versus reusable options within the infection control protocols. So, the main concept of medical device development is those three: material science integration, clinical performance standards and sustainability consideration. So, this is the main concept of fiber engineering, antimicrobial technologies and sustainable manufacturing process, driving the improved patient outcomes and operational efficiency across the healthcare environment. This is the main concept of medical textiles. Thank you.